We're going to talk about xerophthalmia. Xerophthalmia refers to all ocular manifestations of vitamin A deficiency. It is most common in children of 1 to 3 years of age and most commonly associated with diarrhea and measles. The ocular manifestations are: the first one is loss of vision to the green light, followed by night blindness. This is due to impairment to dark adaptation. Conjunctival cyanosis. The conjunctiva will become dry and wrinkled. It appears as sand band at receding tide. Biot spot. It's a triangle, pearly white or yellow foamy spot on bulbar conjunctiva on either side of cornea. In children, it indicates vitamin A deficiency. In adults, it indicates inactive sequelae of disease. Corneal cyanosis. The cornea will become dry and opaque. Severe deficiency of vitamin A will lead to corneal ulcer. Keratomalacia. Liquefaction of cornea is called as keratomalacia. The cornea becomes soft and it will burst open. The extraocular manifestation include follicular hyperkeratosis, anorexia, and growth retardation. Now, treatment. There are two types of treatment: oral treatment and intramuscular injection. In oral treatment, we'll give 3 doses. One is immediately after admission into the hospital. The second dose will be after 24 hours, and the third dose will be after 2 weeks or 14 days. Now, depending upon the age, the dose depends. So, for infants less than 6 months, 50,000 international units are given. For infants of age group 6 to 12 months, 1 lakh international units is given, and more than 1 year, 2 lakh international units are given. Now, for intramuscular injection of vitamin A, the indications are: the child should be severely ill, severely anorexic, and should have edema with malnutrition. It is a water-based formulation. IM, the dosage is half of dose of oral. Vitamin A is contraindicated in pregnancy. Prevention by, first we'll see WHO strategy. WHO strategy, there are 3 action plans. The first one is short-term action. In this, we'll give prophylaxis of vitamin A to vulnerable. This is important: prophylaxis of vitamin A to vulnerable. Now, to lactating women, we'll give 5,000 international units per day or 20,000 international units per week. In women who is in her postnatal period, we'll give 3 lakh international units. And again, for neonate, 50,000 international unit. Less than 1 year, 1 lakh international unit. More than 1 year, 2 lakh international units. Now, medium term action. Here, this action plan includes fortification with vitamin A. Example: dalda vanaspati ghee. This ghee has vitamin A in it. It is fortified with vitamin A. Now, the third one is long term action. Here, we will provide health education, immunization to measles, and treatment for diarrhea, as measles and diarrhea are most commonly associated with vitamin A deficiency. Now, we'll promote breastfeeding and consumption of green leafy vegetables and yellow fruits. Now, National Program for Prevention of Night Blindness. Here, administration of massive doses of vitamin A for children who are less than 5 years of age. Initial doses 1 lakh international units along with MR vaccine at 9 months, and subsequent doses will give 2 lakh international units per 6 months.